Hi everyone, welcome back. Today we're joined by Brandon Webb, the infectious disease physician here at Intermountain, who is also the chair of the COVID-19 Therapeutics Committee for Intermountain Healthcare, to talk a little bit about what's been going on in the last week here in Utah. Brandon, thank you so much for joining us, and it's nice to see you again.
You too. Thanks for having me again.
Yeah, it's been a little bit since you've been on, so we appreciate it. I want to talk about case counts first. The numbers for today have not been released yet, so we're going off of yesterday's data, but I still think it's important to talk about what's happened in the past week. So our case counts as of yesterday were 12,864 with 307 actual new cases reported. Our death counts are now at 128 and hospital totals are 954. Let's talk a little bit about what that actually means. Is that trend line something we were expecting? It's been a month and a half since the economy has opened back up. What are your thoughts on everything that's going on?
Yeah, I appreciate the question. I think those numbers are important to keep track of, but there are some nuance to them. So over the last 10 days, we've seen a clear change in the number of new cases. And that change reflects increased community transmission. And if you look at it, it definitely correlates with community behavior, starting with Memorial Day weekend. Mm-hmm. So in a very real way, the numbers are highlighting that people are getting tired of distancing and taking these steps, but they remain important nevertheless. And when we relax, the numbers reflect that, and we've definitely seen a significant increase in new cases.
And people talk a lot about this term herd immunity as well, and that, well, we should just open back up so that everyone gets it and we can get over this hump sooner. Is there any research to actually prove that that's a thing with COVID-19? I know it is with some other viruses that exist, but is that something that people should rely on?
That's a sticky question. The answer to that is we can't handle being overwhelmed all at once, not from a community standpoint, not from an economy standpoint, because what happens is if it just goes all at once, like we've seen in New York and Italy and other places, our ability to care for people drops off significantly when we are out of beds, out of ventilators, out of medications. What we want is to establish herd immunity in more of a controlled burn, mm-hmm. where we recognize that this isn't going away, but we don't want to get it all over with all at once, because we'll lose more lives that we wouldn't otherwise. And the number of people who have significant recovery times and are out of work is also a significant part of the economic burden. People who are recovering from COVID are not back to work either. So this is a tender balance. It's a tightrope walk, balancing serious and very important economic considerations with serious and very important public health considerations.
And along the line of public health, let's talk about hospitalizations. I think that's the number that I've been told that we really should be paying attention to, because it shows that overload of, can our hospitals actually care for you if you get COVID-19 and get sick? Can you give us a little bit of an insight on what's been happening with that?
Absolutely. Because we've been planning for months to accommodate increased numbers, the answer to your second question is yes, absolutely. The hospitals in Utah are prepared to care for patients with COVID and for patients who need hospital care for other conditions. But our hospital volumes have doubled in the last week. Wow. And that is not widely reported. We've had to open up new COVID ICUs, and we have hospitals that have now exceeded capacity, and we're starting to flow into other alternatives. So at a state level, we're very clearly seeing the hospitalizations start to exceed capacity, and that's linked to community transmission. So it highlights the importance of continuing to be prudent, to be safe. The other thing that I think is really important to know is that this is not a disease of the 65 and older. Many of our new hospitalizations are in patients in the younger age groups, in the 30s, and these are severe cases. We've got patients who are critically ill in their 30s and 40s.
I feel like that's also the group that's probably wanting to get out the most almost because they think they aren't at risk. So they're like, okay, well, I'm not in this risk category that's been defined and been talked about in the news, so I'm free to go do what I want to do, which isn't necessarily the case. I'm glad you brought up those age ranges as well. One other thing I want to ask you about the case counts too is we know there's been protests all over the nation in the last couple of weeks. Are we seeing the reflection of the protests yet in case counts, do you think?
It's hard to say. That's a hard number to track. We have seen an increase in community transmission in the same time periods as the protests, but I can't comment on whether it's directly linked or not.
Yeah, I have a feeling too. I know that the normal period is like that 10-day period. And if you look at the first protest, which I think was last Thursday, you could see after this Facebook Live that the number has drastically increased. So I think it'll be interesting to see what happens over the next couple of days. And there's other holidays coming up too. Father's Day is coming up. Right. So I think it's important to emphasize the fact that you have to keep social distancing. You have to keep wearing your mask in public. It's not something, like you said, that's just going away.
Right.
So a question we also have been getting a lot is the impacts of secondhand smoke and COVID-19, and whether if you're around someone who's smoking or if you pass someone who's smoking, if that can have some sort of impact on if you get COVID-19 or not.
Yeah, that's a really unique question to ask, but I know it's been on people's minds. We don't have any evidence yet that the virus can survive in cigarette smoke.
Okay.
But by the same token, we also recognize that being in close proximity to secondhand smoke is not healthy anyway. So right now we don't look at that as a risk factor, but we do we encourage healthy practices, which include avoiding areas where there is secondhand smoke.
And I'm sure that if you're someone who smokes in general, you typically have lung issues, which could impact you with COVID-19 as well. So I know that quitting smoking is probably a very difficult thing, but it's probably something people should consider with what's going on as well.
Absolutely. Yeah, there's a number of chronic medical conditions that significantly increase your risk of having not only getting COVID, but having severe disease from COVID. Smoking and lung disease are among those. High blood pressure is one that's not recognized. A lot of people historically have not thought about high blood pressure as a risk factor for infection, but with COVID, that might be the single most important risk factor for getting COVID. It's found in at least half of our patients.
That's interesting. Yeah. I didn't know that. Another thing people have always also asked us is about wearing a mask, and whether if you're wearing a mask all day or even for a few hours every day, if that's going to impact you long term, if that cuts off your oxygen supply. There's a lot of rumors out there about wearing a mask. What are your thoughts on that?
Wearing cloth or medical grade masks, while uncomfortable and inconvenient, doesn't have any long-term effect on respiratory function. It's safe, and as somebody who wears one all the time in the hospital, it's not a concern from a health standpoint, and we want to continue to encourage the use because we wear the masks really for others. You know, when people ask, I tell them that I'm wearing the mask out of respect for others because I work in a hospital, and I would not want to be inadvertently shedding or putting others at risk. So we typically think of masks as something we do to protect ourselves, and there is some of that, but it's incomplete. The real advantage to the community wearing masks is to protect others.
That makes a lot of sense. I feel like that thought process too of restriction to breathing is that it's something new. We're not used to wearing a mask. I know the first time I wore a mask, I wore it inside out, and it was very difficult. It was a surgical mask, and it was very difficult to breathe. But I knew it was more of a mental thing too, of trying to get over this thought process of having to put something else on that I'm not used to. And as a doctor, you guys are very accustomed to wearing them. So I just hope people realize that they do work, and they are helping to slow the community spread that's going on in our state and country.
Yeah. There was a new study that was just released in the medical journal Lancet that actually looked at a large amount of research around masks and confirmed that they are effective. So it's nice to know that this isn't just a political move. There is good science behind it.
And speaking of Lancet, I wanted to talk a little bit about clinical trials. I know you're very heavily involved with them. Can you give us an update on how those are going in the state, anything you guys have learned that you can share, and then talking about that study that was released and the retraction that was released afterwards as well?
Yeah, that's been in the public eye. I'd be happy to. We're really excited about what's going on in the state from a research standpoint. Right now, there are 10 clinical trials that are in various stages, and we've learned from each one of them. But also, while we've learned from those, we've also used those as an access for therapies that we still anticipate will prove to be effective. So we've had hundreds of patients who have accessed care for COVID through clinical trials. And we continue to look at that as a really important pathway for accessing treatment in a safe and monitored way that also helps to inform the best way to treat it going forward. So we're continuing to evaluate and try to attract the best possible clinical trials and are committed to participating in really the cutting edge. The second question, there are multiple levels of quality when you look at research, and the highest quality evidence comes from randomized controlled trials. Those are controlled trials that are unbiased because they are controlled in a randomized way. So there's the groups in those trials in each experiment and control group or placebo group are equal. There are other really important methods of doing research that have some limitations. And in this study that was published in The Lancet, it was not a randomized controlled trial. It was a different type of research that doesn't generate the same level of quality. And the problem with some of those studies is if the data used in the analysis is not accurate or not collected in a careful way, then the interpretation and the results can be biased. And that's what we unfortunately found with that study. It came to light that the database that was used was not validated. And so the results of that study were also not valid.
That's pretty interesting. I know that the initial study was everywhere. I was seeing it on everyone posted it on Facebook. It was circulating everywhere. So I think it's really important for people to do their own research on what they're looking at and make sure it's something that they trust and then keep checking on it.
That's right.
Because things change. It's May. Nope, June. It's June. It's only been around for 5 months and we only have that much data. So things are going to constantly be changing. So I think it's important that people keep checking if they're interested. So
that's right.
Brandon, is there anything else you want to mention today about anything that's been happening in the community or anything that's on your mind?
Top of mind right now is, our number one goal is to keep people safe. And we're really optimistic that as we learn more about treatments, that patients who do require care for more severe COVID are able to receive top quality treatment. But at the same time, we don't want to use that as a false sense of security. It's critical that we continue as a community to pull together. To really continue to do the social distancing because it works. And there are lives, young and old, that depend on it.
Well, Brandon, thank you so much. I really appreciate the time with you today. And like Brandon said, if you're having an emergency, if you have COVID symptoms, you can't breathe, your lips are turning blue, you're feeling unstable, we really encourage you to go seek care. Our hospitals are still safe, they're still open, and we're here to help you guys. We also still have our COVID-19 hotline available. You can call to get screened at 844-442-5224. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.